Hi, my name is Carly Kahn, and I am the nurse educator for Stephenson Cancer Center. I will be presenting information for our Chemo 101 class. Welcome to Chemo 101. This class was created to prepare patients and caregivers for chemotherapy treatment at Stephenson Cancer Center. You will have the opportunity to learn about what to expect while receiving chemotherapy, as well as tips for managing common side effects. We have an interdisciplinary care team that will help to support you and your family during this process. We will begin by briefly explaining some of the different roles of our dynamic team. Our financial navigation team will assist you in many ways throughout your chemotherapy treatment. After your physician selects your course of treatment, the financial navigation team will check to verify your benefits. They will process any authorizations needed before you start treatment and determine any copays, deductibles, or out-of-pocket costs that you may be responsible for. Depending on your income and insurance coverage, you may qualify for financial assistance through a foundation program. In this case, the financial navigation team will help connect you with the funds that will best suit your needs. Our supportive care clinic consists of many different specialists that can provide support and resources to manage symptoms from cancer treatment and encourage healthy living. Interdisciplinary experts in supportive care can help you restore and maintain a good quality of life throughout your treatment. Please notify your physician if you would like to be referred to any of these clinics, or you may contact supportive care directly. We understand that a cancer diagnosis and treatment can lead to a great deal of stress for patients and caregivers, but our teams are here to help. Our oncology social workers are available to assist you with a variety of needs during your care. This may include providing you with community resources and coping strategies to help you navigate your cancer journey, assistance with transportation or lodging arrangements, discussing family concerns, and connecting you to support groups within the community. Social workers and our team of psychologists and psychiatrists can also help you manage the emotional side of cancer. You may experience many different feelings during treatment, including denial, anger, fear, anxiety, or loneliness. The good news is that all of these feelings are normal. Our specially trained teams can provide you with the resources, counseling, and coping strategies to help you navigate. Please contact our social work team or supportive care clinic for additional support. If you or your loved one is experiencing an emotional emergency, please call 911 or go to the nearest emergency room. Free 24/7 support is also available from the Suicide and Crisis Lifeline by calling 988. The volunteer program at Stephenson Cancer Center offers various services that provide meaningful impact for patients, caregivers, and staff, including lunch and snack services, animal therapy, music therapy, and more. Stephenson Cancer Center offers support groups for many different types of cancer. Ask your clinic care team or contact Lisa England at 405-271-8001 extension 32265 for more information. Another service offered within our supportive care department is rehabilitation. This team of physical and occupational therapists help manage side effects from treatment, as well as cancer-related pain, weakness, and fatigue. Our cancer rehabilitation department sees patients at any stage of the cancer journey. Other services offered by our rehab specialists include occupational therapy for help with managing swelling. Occupational therapists can also teach strategies to assist with energy conservation and changes in memory. Physical therapists can help manage swelling as well. If you experience changes in balance or weakness, physical therapy may increase your strength and help reduce your risk for falls. Remember to talk with your doctor about any side effects you are having. If you are interested in speaking with cancer rehabilitation, please contact their team. Our team of oncology dietitians can provide many valuable services to you during your treatment. They can assess your individual nutrient needs, provide information about side effect management, and work with your care team to develop a plan that is right for you. If you have nutritional concerns that develop during treatment, our oncology dietitians will be happy to help. Nutrition is an important part of your cancer treatment because the food that you eat can help you maintain adequate energy and manage certain side effects associated with treatment. There are 3 components that are very important during cancer treatment: calories, protein, and fluids. We will talk about each of these briefly. Some patients receiving chemotherapy experience changes in taste or nausea, which may lead to decreased appetite. However, maintaining sufficient calorie intake is important. Eating a snack or a small meal every few hours will help you maintain the best possible energy while your body heals. Your treatment days can be long and require a lot of travel, so remember to bring snacks with you to eat throughout the day. Please reference this slide for nutritious snack ideas. Protein helps your body heal, gives your immune system support, and maintains your muscle mass. Good sources of protein can be received through animal protein such as chicken, turkey, beef, pork, and fish. Dairy proteins are milk, cheese, yogurt, and cottage cheese. Plant-based proteins are nuts, beans, lentils, and peanut butter. Adequate fluid intake helps to prevent dehydration and promote regular bowel habits. Fluids also assist with kidney function and flushing out toxins after chemotherapy. We encourage you to drink at least 64 ounces of fluid daily, every day. Alcohol should be avoided while you are receiving cancer treatment. Chemotherapy involves receiving one or more medication. There are several different routes which may be used to provide the medications that you need. Common routes include oral, which is given by mouth in pill or tablet form, or intravenous, which is when medications are delivered via infusion through a port, PICC line, or peripheral IV. There are many similarities and side effects between the different routes of chemotherapy. We will first discuss important details regarding oral chemotherapy. Please note the next few slides are not applicable for patients who are receiving chemotherapy via intravenous infusion only. The first step is regarding how to take your oral chemotherapy. Take the medication as prescribed by your doctor, which is indicated on the prescription label. Do not chew, crush, or break the medication. Take with or without food as stated in the instructions. Always wash your hands after taking the medication. If you miss a dose, throw up a dose, or experience significant side effects, please contact your clinic care team. Now we will discuss handling your oral chemotherapy. Chemotherapy can stay in your body for hours or days. It can be found in your waste such as stool, vomit, and urine. Always wear gloves when handling clothes or linens with body waste. Wash these items separate from other laundry. Caregivers should not handle oral chemotherapy unless they are trained to do so. If you have a trained caregiver, they should always wear gloves and wash their hands before and after handling the medication. Pregnant caregivers should never handle these medications. Wash your hands with soap and water after handling oral chemotherapy or clothes and linens containing body waste. The third and final step we will discuss about oral chemotherapy is storage. Always store your medication in the original containers and according to the instructions. Keep the medications away from children, pets, and preparation areas. If you need to dispose of excess medications, please drop them off at the drug disposal box located in the pharmacy on the first floor. Stephenson Cancer Center has board-certified oncology pharmacists. They are an extension of the care team and work closely with your physician to provide seamless, convenient, and safe care. Our pharmacists are available for any medication questions. We encourage you to continue to take all of your regular medications as prescribed, unless recommended otherwise by your provider. Retail pharmacy technicians will work with your insurance company to secure any authorizations needed for your oral chemotherapy medications. Technicians find financial drug assistance, verify benefits such as copays, out-of-pocket costs, and any authorizations your insurance company may require. For any assistance with oral chemotherapy coverage, please contact them. Here at Stephenson Cancer Center, we have a vast variety of nurses that work in specific areas throughout the cancer center. Each type of nurse plays a particular role in supporting you throughout your cancer journey. Our infusion nurses administer IV hydration, chemotherapy, immunotherapy, and injections in the infusion center. Our Phase 1 infusion nurses administer investigational study medications to patients who are participating in a clinical trial. Our clinic nurses work in the doctor's offices assisting the providers who are seeing patients in clinic. They also help with prescription refills, side effect management, and fill out medical paperwork for insurance and employment purposes. Our research nurses are the point of contact if you are participating in a clinical trial. They help manage side effects related to treatment from a research study. Our nurse navigators offer an individualized assistance to help guide you through the healthcare system and overcome barriers. Our chemo navigators assist you with navigating through all the phases of your treatment journey from start to finish. Now we will discuss the details of our chemotherapy and infusion center, which is located on the 3rd floor. The infusion center has experienced staff, which includes nurses, nurse practitioners, and pharmacists. The hours of operation are Monday through Friday, 7 a.m. to 6 p.m. We are closed for federal holidays. Our treatment room is set up of 5 pods, which includes 45 treatment chairs. We have 3 nurses that work with each pod. You will get to know our staff, and they will take great care of you. To schedule an appointment, please call us. Our phone line is open from 8 a.m. to 4:30 p.m. Feel free to leave a message and the staff will return your call the next day. You will be allowed 1 visitor to accompany you to the infusion center. However, due to safety reasons, children under the age of 16 are not allowed in the treatment area. At check-in, we will verify your personal information, give you a wristband, and your caregiver a name tag. Most chemotherapies are dosed based on body surface area, which is calculated using your height and weight. Once the staff have recorded this information and the orders are reviewed, the pharmacy will begin preparing your chemotherapy. Treatment times range based on regimen. You may ask your clinic care team or infusion nurse about the expected length of time for your treatment. We will do whatever we can to make you as relaxed as possible when you're here. Please dress comfortable and warm as it can be cool in the infusion center. Heated blankets are available for your comfort. If you have a port, wear clothing to make it easy to access, such as a button-up shirt. We provide a cart with snacks and drinks for our patients. We have Wi-Fi, so feel free to bring an iPad, laptop, or tablet. Next, we will talk about different ways that treatments are administered. Most patients will have a central venous catheter placed. Few patients will receive treatment through a peripheral IV. A central venous catheter is a thin catheter that is inserted into a vein that goes into a larger vein near the heart. CVCs are often utilized to deliver chemotherapy, blood, or fluids to patients with cancer. It can also be used to collect blood samples. There are various types of central venous catheters. The 3 most common are an INFUSION, PICC line, and HICKMAN catheter. Central lines can remain in place for weeks, months, or years and help a patient to avoid repeated needle sticks. Monitor your CVC site daily for any signs of infection such as redness, swelling, or warmth. Contact your clinic care team should you notice any of these symptoms. Now we will briefly talk about each type of central venous catheter. A port is typically placed under the skin in the upper chest during surgery. It is accessed with a needle by a trained nurse prior to each use. Once the port site has healed after surgery, a patient can shower and bathe normally as long as it is not currently accessed with a needle in place. A port can remain in place for months to years. If the port is not actively being used for treatment, it should be flushed by a trained professional every 6 to 8 weeks. A PICC line is placed in the upper inner arm by a trained nurse, advanced practice provider, or physician. It often requires daily flushing and weekly dressing changes. A PICC line should be covered when showering. Baths and swimming should be avoided. A PICC line can remain in place for several months. Avoid having your blood pressure checked on the arm with the PICC line. A HICKMAN catheter is a tunneled catheter that is placed during surgery. It can stay in place for months to years. It often requires daily flushing and weekly dressing changes. Keep the catheter covered when showering. Avoid swimming or bathing. When you are receiving chemotherapy, lab work is an important part of your care. By assessing your labs, your care team can look for specific markers and verify that you are healthy enough to receive treatment that day. In general, labs are required within 24 to 72 hours of your scheduled treatment. We prefer that you have your labs drawn a day or 2 before your infusion. However, if you must have labs done on the same day as your treatment, be sure to have them drawn at least 3 hours before your scheduled chemotherapy appointment. This is for safety so that your team will have adequate time to receive results and review them prior to your treatment. If you are on a clinical trial, you will need to have your labs drawn in a specific time frame. This time frame will vary by study, so remember to check with your research nurse to see when you should have labs drawn. Most labs can be drawn on the 2nd floor of the cancer center. However, if you have a central line, remember that labs will need to be drawn in the infusion center by a nurse. Please make an appointment to have your labs drawn in infusion by calling 405-271-3402. If you would like to have labs drawn at a location other than Stephenson Cancer Center, please remember to get an order slip from your clinic care team and have the results faxed to 405-271-2491. Your provider will likely draw a CBC, complete blood count, before each infusion to monitor components such as white and red blood cells, hemoglobin, and platelets. Chemotherapy often causes many of these blood counts to drop. With most chemotherapies, this happens 7 to 10 days after treatment. This is called the nadir. Your white blood cells are part of your immune system and they help protect you from infection. When your white blood cell count is low, it increases your risk for infection. Avoid people that are sick, practice good hygiene, wash your hands frequently, and carry hand sanitizer. Your healthcare team will notify you if your white count is low and if any additional precautions are needed. Be sure to contact your care team if you develop a fever of 100.4 or higher while receiving chemotherapy. Red blood cells carry oxygen and nutrients to all of the organs and muscles in your body. When your red blood cells or hemoglobin is low, you have anemia. If you are anemic, you may experience symptoms such as fatigue, dizziness, or shortness of breath. These symptoms should be reported to your care team urgently. Platelets play a major role in blood clotting. They help to slow or stop bleeding within the body. When one's platelet count is low, it is called thrombocytopenia. Symptoms of low platelets are easy bruising, petechiae, which are small, flat, red dots on the skin, nosebleeds, and bleeding that is difficult to stop. If you experience any of these symptoms, report them to your care team immediately. Next, we will discuss some of the general side effects of chemotherapy. Keep in mind that chemotherapy affects everyone differently, so listen to your body. For specific side effect information on the treatment you will receive, you can visit chemocare.com. If you are on a clinical trial or immunotherapy, be sure to notify your care team of any symptoms you experience. One of the most common side effects of chemotherapy is fatigue, and it is important that you get plenty of rest. Prioritize your activities to conserve your energy. Ask for and accept help with childcare, cooking, shopping, housework, or driving. Most caregivers would love to help you out, you just have to let them. The best remedy for fatigue is activity and exercise, so try to be active when you feel able to. With some chemotherapies, alopecia or hair loss is a common side effect. Chemotherapy attacks fast-growing cells, which includes hair follicles. Loss of hair affects all body sites. Hair can be very fragile while on chemotherapy, and ponytails and dyes can break the hair easier. If you experience hair loss, your scalp may be sensitive. It is important to avoid harsh soaps and shampoos during this time and use a gentle cleanser such as baby shampoo. If you are interested in a wig, ask your care team to provide you with a prescription. Some patients experience nausea and vomiting from chemotherapy. Prior to your infusion, you will likely receive pre-medications to help prevent or reduce nausea and vomiting. You should also receive a prescription for anti-nausea medication to take home with you. Take this as directed if you experience nausea or vomiting. Eat small, frequent meals and stay well hydrated. Crackers, rice, applesauce, and toast are examples of bland foods you may be able to tolerate when you're experiencing nausea and/or vomiting. Please report vomiting lasting longer than 24 hours to your care team, as it can quickly lead to dehydration. It's possible you will experience constipation or diarrhea from your cancer treatment. Tips for managing constipation include increasing your fluid intake, eating prunes, bran flakes, or legumes, staying active if you are able to, taking an over-the-counter stool softener as directed on the label. Be sure to avoid suppositories while receiving chemotherapy. If you go more than 3 days without a bowel movement, experience significant abdominal pain, or are unable to pass gas, contact your care team. If you experience diarrhea, it is important to stay well hydrated as diarrhea can quickly lead to dehydration. Monitor your temperature. Eat foods such as bananas, rice, applesauce, and toast. Speak to your clinic care team about over-the-counter or prescription treatments for diarrhea. If you have more than 6 episodes of diarrhea in a 24-hour period, diarrhea which awakens you from sleep, bloody diarrhea, or fever 100.4 or higher, accompanied with diarrhea, notify your care team. Mucositis is an irritation of the lining of your GI tract, which can cause ulcers in the mouth and throat, making it painful to eat and swallow. Eat soft, bland foods at room temperature. Practice good oral hygiene and contact your care team for further recommendations. Cancer treatments often cause skin changes such as dryness, itchiness, or rashes. Keep your skin well moisturized by applying gentle, non-scented lotion several times per day. Avoid long showers, baths, and hot tubs, as this can cause weakness, dry skin, and increase itchiness. Be sure to notify your care team if you develop a rash. Some chemotherapies cause peripheral neuropathy, which is numbness and tingling, most often to the fingertips, hands, toes, or feet. If this sensation is constant, you have difficulty with balance, trouble opening a can, buttoning a button, or picking up small objects, notify your care team. If you experience dry eyes, you may use over-the-counter moisturizing eye drops. Report any changes in vision to your care team. Lastly, sexual changes are common during cancer treatment and should be discussed with your care team. If you are of childbearing age, protection during intercourse should be used while undergoing cancer treatment. In summary, be sure to discuss any concerning side effects you're experiencing with your care team. Our clinics are open Monday through Friday from 8 to 4:30. Our main line is 405-271-1112. After hours or holidays, you can call our main line and ask to speak to the provider on call. For any life-threatening emergency, call 911 or go to the nearest emergency room. Thank you for choosing OU Health Stephenson Cancer Center for your care. We are here to help you through every step of your journey. In summary, be sure to discuss any concerning side effects you're experiencing with your care team. Our clinics are open Monday through Friday from 8 to 4:30. Our main line is 405-271-1112. After hours or holidays, you can call our main line and ask to speak to the provider on call. For any life-threatening emergency, call 911 or go to the nearest emergency room.